Thank you, first of all, Ben, for having us, and great to see you again, Dick. I think we can go ahead and start with the poll. I think it will help inform some of our conversation here.
Okay, let's see. My team is going to do that. I'm going to put myself on mute, and I'll chime back in once the results come in. All right. So why don't you two take a quick minute and give a little bit of background of each other while the poll is being run right now, and then I will come right back with it by the time you two are probably done with your backgrounds.
Sure.
Great. Amanda, please.
Okay. Able Partners is an early stage venture capital fund, and we focus on what we call the positive living space, companies making the daily lives of people healthier, happier, and more meaningful. And as part of that, probably the area that we have focused the most on has been mental health. So you can obviously see where our interest in psychedelics came from. But we have another lens that we often apply, which is the lens of stigma. So we look at communities, founders, conditions that have been underserved because of historical or cultural stigma. And psychedelics certainly, hits that both in terms of the compound as well as the mental health applications. So this is an area that we've been really interested in as part of our broader work in the positive living space, and excited to be here with Dick today.
Great. Thanks, Amanda. And I'm Dick Simon. As background, sort of serial entrepreneur in a variety of fields, and have spent much of the last 20 years on destigmatization across geopolitical conflicts in the Middle East and India, Pakistan. Became really interested in the potential of psychedelics around 5 years ago, both because of the incredible data that's come out, as well as personal interest dealing with mental health issues in the family and realizing that our current tools just aren't adequate. So a lot of what I've been doing is around this destigmatization and finding opportunities both in the for-profit world as well as in the philanthropic and nonprofit world, and just doing all I can to help advance this work in this field. So some investments and a lot of other activities.
Well, as promised, you did your intros, so the results are in. Do you think the emergence of for-profit companies in the psychedelic space is 67% positive for the field, 22% negative and should be discouraged, 11% neutral, neither good or bad? I'll turn it over to you to advance that conversation point.
Yeah, super interesting. I mean, Dick, I think one of the things that we have talked about before is, what are the roles of, for-profit companies relative to philanthropic efforts, relative to, the clinical research going on in the space. And I know that you are also involved in sort of all three areas. So how do you see that?
So I see this whole artificial delineation is really problematic. I think that for-profit companies, nothing has ever been brought to massive scale without for-profit involvement. So I think that the idea, these are magical and should never be dealt with in a for-profit way, probably won't work in the very short term in the world that we currently live in. I think research institutions are incredibly important because that's really what underlies all this. It's great to be able to figure out how to most effectively manufacture a product, as we're just watching a fascinating presentation. But until we know what's really working and why, we don't have anything to sell or service or set up clinics around. So I think that's really important. And then MAPS, which has just launched their capstone fund, raising $30 million on a matching basis. Without them, we wouldn't. That's the first product that in all probability will be approved, which is MDMA for PTSD. And that's a $30 million matching fund that just got launched. So I think all three are really important. And I'm reminded of when years ago when I was coaching our son in soccer. And I was great at doing that when they were 5 and 6 years old, because all you had to do was communicate. You're on the same team. Everybody has the same basic goals, and just focus on the goals. So that's my perspective.
Yeah, and I echo a lot of that. I mean, I think that there's a role for all three types of institutions. And I think, I look at it a little bit on a timeline basis. And I think, obviously, I think, none of us would really be here today without all the amazing work that MAPS did. And when, Rick was starting MAPS, that wasn't a time when there was the ability for-profit companies to enter the space, because to your point, there wasn't any profit to be had. There wasn't really a business model to be had. So I think that the work he has done that all of them at MAPS have done, is obviously critical and was necessary at that point of time. And then when I look forward, my goal, as I think it is, many of the people here, is really to have safe and scalable access as quickly as possible. And when I think about what that means and what sort of models will get us there as quickly as possible, the main difference between a nonprofit and a for-profit company is really who are their funding sources. A nonprofit obviously being funded via donors, and a for-profit being funded via shareholders and eventually profits from the company. And frankly, although that fundraising can be an issue in both types of businesses, there's less uncertainty and usually the ability to raise more money faster once there is some sort of a profit-based model available. So when I look at getting these compounds, doing the necessary research and making sure that we're using them in the right ways and validating all of our theses here, I think the private sector approach will be faster and more sustainable in the long term. Although I think that MAPS is doing interesting things with the Public Benefit Corp, which maybe will show another way. And then there's also, the cannibalization to a certain degree of charitable dollars, when we're now in a time period where people are willing to put large amounts of money into these for-profit companies, which are looking to expand access to these compounds. I think that I'd rather see charitable dollars used for indications that don't yet have a potential for-profit case or other business models that would support private investors.
I would agree with you completely. I mean, I'm chairing the advisory council at Massachusetts General Hospital, a Harvard-affiliated hospital, and they and many other great medical institutions are doing work that doesn't yet make sense in a for-profit company, and are also using tools and doing more basic science than than necessarily would make sense. They're also finding that there are a lot of partnership opportunities. So some of the for-profit companies are reaching out to them to do support, to work, etc.
So I'm just going to jump in. I have an audience question, so thank you for that. And I know you both said that if relevant, I can cut you off to ask it. So what are your thoughts on the statement on open science and open praxis with psychedelics?
Dick, go.
Oh, me? All right. So I'm aware of it, and to the extent that the intent is that people are sharing information, I think that's great. To the extent that it ends up undermining the possibility of companies raising money because they're looking to have intellectual property, you end up losing all of the funding that otherwise could go into that space. So I think sharing information and cooperative is great. I think that making it impossible to work within the private sector is problematic. So I think it's both.
And I think you hit the nail on the head. I'm also on the board of the Melanoma Research Alliance, where we have backed many of the new compounds that have come out for cancer treatment beyond melanoma, and we have been very focused on making sure that there is more information sharing than there has historically been, but you still have to do that within a context that people have an incentive to do the work and invest the money to get these drugs to market, because ultimately I'm interested in translational medicine and getting these compounds to patients, whether it's on the cancer side or it's on the mental health side. So I think you have to weigh those two pieces.
Yeah.
And I guess related to what we were talking about, when you're looking to invest in for-profit companies, Dick, are there any specific ethical questions that you look at before you?
Absolutely. I mean, I've been doing, pre-psychedelics. I've been doing investing in activities for quite a while. And I think the key thing, you want a good business model, you want a reasonable runway, projections are sort of interesting. Anybody can run a spreadsheet, and the only thing you know for sure is it will never turn out exactly the way it was in the projection. You hope it's better, but it might be worse, but it won't be the same. I think that very, very much so is the integrity of the people you're working with. You want competence, which is great, but if you don't have strong integrity, things will fall apart. somewhere along the line. So it's like really good people, smart people, from a people standpoint, but the integrity is really important. I think that, you know, one of the things that may happen in this space is there's like a gold rush. I mean, people who've done well in cannabis, or seen others do well in cannabis are like, well, this is the same. Well, yes, they're both Schedule I drugs, but it really stops there. You know, one is recreational, one is daily doses, one is pick up at your dispensary, and the other is really a therapy. It's expensive, it's complicated, and it's a real medicine. So, you know, hugely different runways, hugely different cost structures. And so I think I want to, you know, just sort of put out there just the concept that they're very, very different concepts.
Yeah, I mean, I agree with all of that. You know, certainly, obviously, if we're investing in a for-profit company, we do our usual business screens. And I think in this space, you know, I think on the one hand, everybody has a bit, you know, the integrity piece is critical because everybody has a little bit of an obligation to make sure that I think that we stay just even a tad bit more conservative than you normally would be to make sure that there are no incidences which would set back the space as a whole, which I think, you know, a lot of people feel like that could happen. And I think that, you know, I've spoken to a number of founders who have seen some of, you know, the decrim or other efforts and have wanted to start companies that were consumer facing and not within the current legal or regulatory framework. So, you know, I think that's something that for us is important, that people are working within, you know, the current legal framework and, you know, this gold rush mentality that you mentioned, and a lot of people seeing what happened in cannabis or experiencing it, are trying to apply that consumer model, which is not, you know, is not the right model to apply, because to your point, you know, these drugs are at least half a service, and the service model is very different than the cannabis model. And so you want somebody who understands that. And I think, you know, all of the companies that we have invested in the space, I can say that the management team and founders, their greater goal has been for mental health. And I think that was important to us to understand that, you know, there was some sort of personal connection, authenticity in there, and their desire to build a company in the space versus pure, you know, although I'm a capitalist, I think, you know, this is a space where it particularly helps to have, you know, other motivations.
Yeah, I mean, I would completely agree with George's comment yesterday that, you know, psychedelics are a really great tool, but it's really about how do you use that tool to transform mental health.
Right.
I was going to comment that there's so much focus on the drug development piece, and that's really important. And we're fortunate to be early investors in Compass, and, you know, all this is looking great. But there are tremendous opportunities of helping build the infrastructure, not just the drug development piece.
Yeah.
And I was wondering, Amanda, did you want to talk to that? And then I've got a few things I might add.
Yeah, absolutely. I mean, you know, I think when you look at the space, when we first decided to invest in the space, I made a very deliberate decision to say, I'm going to take a 20-year view, because at the time, you know, I think you can look at all of the historical data, you know, even though those trials were not run to today's standards, and even then look at, you know, the beyond that sort of indigenous usage. And I think there was enough evidence out there to say that I think these compounds might be successful in sort of phase 1 trials. But beyond that, I didn't know where this industry was going to go, except to say that I did believe that psychedelics had the potential to play a big role in our mental health system going forward. So I think we took that approach. But now as it sort of matures a little bit, you know, we look at where do we think the interesting value creation will be in this space. And, you know, some of the areas and the way that we divide and look at the space are, you know, the distribution piece or the physical infrastructure piece, sort of the clinics and the retreats. There's also sort of the human infrastructure piece, which I think is, you know, a lot of people have drawn attention to the fact that there will be a real need to train therapists here. And what does that look like, staffing and therapists at any of these centers when you're distributing it? And of course, the IP around the actual compounds themselves, as well as the protocols, which is very important, because we know that set and setting and the specific protocol that you use, unlike other drugs, can have a huge impact on what the therapeutic benefit of these compounds are. So that's another area of potential, you know, business formation and value creation. And lastly, I would say sort of the tech stack and the tech platform around it. So you know, all those pieces that will be used, whether I think probably the most defensible and interesting are more on the, you know, sort of intake side, the integration side, and sort of following a patient through that process. So, you know, right now I would say I think what's most interesting to me is, the compound side certainly, but going forward, I think the IP around the protocols and the tech stack are going to be, more interesting areas that need more investment and development to be able to bring these drugs to scale.
Right. I would agree with you completely. And it almost, to a certain degree, goes back to that earlier question about for-profit, not-for-profit. I mean, when in massive amounts of funds will be needed in this space.
Yeah.
And in a single week, last month, we had between Compass and Atai over $100 million being raised in a space that hadn't ever seen that much money. And obviously it was a good week, but it's the start of many, many good weeks. I think that it just becomes like, as you go through the list, and I would completely agree with your list, there are so many opportunities that are going to require very significant capital. And it doesn't always work out. I mean, it's the nature of investing, but
and are there certain areas that you as an investor find most interesting and are most focused on?
Well, I think clinics are a little bit tough because I think services that support clinics are a really interesting area. And we're looking at some opportunities there. I think that the clinics themselves have massive capital investment required. Just how do you scale that in a profitable business? Not to say that people won't figure it out, but in terms of sort of our looking at it. I find things really interesting around integration with third-party payers because behavioral health or mental health is an important area. It still represents a tiny percent of healthcare payments, but a key to making all this work will be somehow or another integrating third-party payers, be they insurance companies or government agencies, and providing a platform that can be used by them so that they know what's going on and they can feel very comfortable with it. And then I also go with you, on training and how do you train at scale? Because the numbers of people who are being trained now are infinitesimal against what the eventual demand will be. I'm involved in the group California Institute for Integral Studies that has a therapist training program, and it's great what they're doing, but the numbers, it's like hundreds are being trained through that over time, not the many, many tens of thousands that ultimately. So one of the things, one of the things that we're doing, like at MGH, which again, it's not a for-profit, but is looking at that platform and Harvard's infrastructure. How do you offer this to massive numbers of people already in the field? Already psychiatrists, already psychologists, who we're in a bubble. I mean, it's fascinating. Everybody on this, on the panels and in the audience, this is a tiny bubble. And it doesn't feel like it because everybody else we talk with is in the bubble with us. But you leave that bubble just a little bit, and it's astounding how little is really understood about the potential of these substances and the therapies associated.
Yeah, absolutely. I mean, I think that's super interesting. And, to your point about the integration work and the payers, well, I think it goes back to our the need of, what sort of model are you building here? And I think a lot of the work that's being done, especially some of the for-profit companies have to be focused on is reimbursement and who the payers will be. And ultimately that's what to me means access. Access is, not that you can afford to have an underground guide and get introduced to the right person and hope it's safe, but that actually your insurance company is willing to reimburse when your doctor refers you to this type of treatment. So I think that's hugely important on the access side. And I also think in terms of integration, it's integration, and then it's, even that next piece, which is we know that you have this sort of window of neuroplasticity and the ability to make changes in your life. And is there something related to the treatment, which can be a longer term, interaction that encourages you, tracks you, somehow helps you make those changes, which will ultimately impact, both your physical and mental well-being when you have that window post-treatment.
Hey, I'm just jumping in real quickly. We asked a poll earlier, and I would love both of your reactions to this because it dovetails so nicely into Dick, what you were saying, and Amanda. We asked the audience to choose where the best psychedelic investment opportunities are in. Number one, 46%, medicine development formulation. Number two, clinics and retreats, 31%. Number three, testing and delivery, 15%. Education and training, 15%. Services, marketing, legal, sales, 8%. Curious what your thoughts are. Curious what you feel about that.
I mean, the one thing I sort of didn't hear there was maybe like the tech layer, that platform piece, which I'm
Correct.
interested in personally. You know, I think also right now, and I don't know fully the composition of the people who answered that question, so that might inform how I look at the answers. But I think when you see what is available right now, the majority of the companies that I've spoken with have been either in the drug development space, or I would say the clinic retreat space, because I think those are the two types of businesses that have so far have been have proliferated the most. And I think, you know, the retreats, there are certain legal jurisdictions right now where you can have a retreat, so that might be where some of that interest came from. Interested to hear your thoughts, Dick.
So a couple of thoughts. One is I'm always as an investor tend to try to be contrarian. You know, if I were out in the California gold rush days, you know, I'd be figuring out how to sell pick shovels or make Levi jeans. So yes, a lot of the money is racing to drug development, and there will be some significant successes there, no doubt. There also will be a lot more carnage. And the amounts of money required to succeed there are much, much larger than in any of the other spaces. The retreats are still primarily really a niche business. I mean, you're right. You know, you can do that. You know, Synthesis is doing that well in the Netherlands. You know, there are several others, but that's still a relatively small business. Not to suggest that they won't do well, but until these substances are more widely available, it's not clear. I'm actually really interested in having some conversations with some people who were dealing with exactly what you were talking about, the third-party payer issues, because what's fascinating is, you know, we may view it from the perspective either a business opportunity or alleviating mental health suffering, both of which are really valid. They can be looking at it and are looking at it as, wait a second, if I can do some ketamine-assisted psychotherapy, which costs a lot more than individual sessions, but the net effect is I don't need to pay for nearly as many, I own this patient, and I don't need to pay for as many sessions, all of a sudden there's huge economic incentive. And I think that can open up major opportunities currently with ketamine, because that is available legally, be it Spravato or be it generic. And ultimately with a lot of these other compounds, it becomes in the interest of those payers to overall reduce their financial exposure for behavioral health.
You know, and I think that's going to be really different depending upon which payers you're talking about. So, you know, I have been disappointed, having looked at so many things in sort of this wellness and mental health space, to find that the US payers, the average length of life that they will have, you know, the average time they will cover a person in the US system is somewhere around 4 years. So any case that you make over 4 years, and even if it's sometimes over 2 years or 1 year, they often are not interested in that ROI. I thought it was an easy math equation, and I thought it would make sense for them. But, you know, I think in certain places, maybe in the UK, where you know, the NHS actually does own those lives for a longer period of time, they're able to take a longer term view. I think the challenge here is that in the US payer system, they don't take as long a term view in many cases because they don't own that life for as long. So I think that's going to be one of the interesting things we have to explore.
I think you're right. I think that different payers have very different perspectives. I mean, you know, yes, NHS on one extreme, but company paid plans where they're expecting to retain their employees for a longer period of time, and as well own the comorbidities that come associated with it, or just as an employee, well, they're good, but they're not here a lot, and all of a sudden the equation becomes very, very different. In addition to, you know, companies may care more about individuals working for them, but even excluding that, they have significant additional returns by having a healthier workforce.
Yeah, one of the interesting things we've seen in this sort of post-COVID world, and I'm interested if you've seen any changes, but we have seen with our mental health investments generally a significant increase of demand on both the enterprise and the direct-to-consumer side. So, you know, the good and bad of that. The bad is, of course, our current mental health crisis was already huge, and it seems like it's getting even bigger. The positive of that is that we're seeing more companies willing to invest in their employees' mental health and recognizing that is, you know, it's a productivity issue. It's, it's a retention issue. It's, it's all of those issues that you can make a business case for, not to mention also a humanitarian issue. So I'm curious to see if we are in a recession or a post-COVID world, if we'll see, as you said, employer payers willing to continue to invest more in the mental health side, which would include ultimately some of the psychedelic treatments, or whether they'll be tightening their belts and start cutting some of these benefits.
Well, I am hopeful that because mental health has got a huge impact out of COVID, that a silver lining out of an otherwise extremely dark cloud is tremendously increased interest in mental health issues. I mean, it's gone in the States from 4 to 5% of the people on any given day would test for mildly depressed, which can, for those who are suffering acutely, that goes on for a long period, and it's way worse than mildly. For many, it's just like a bad day or a bad few days, and everybody has them. Now that number is 20%. So you've increased the awareness of mental health issues because of the instability, because of job loss, because of lack of control. And the hope is, on the silver lining side, that the whole issue of mental health just gets dramatically elevated.